from beginning. Okay. My name is Annette van Ginkel. I am working in King Abdullah bin Abdulaziz Hospital in Saudi Arabia in Riyadh. We started to be a little bit cooler now. So as everybody knows, Saudi Arabia is very, very hot. So this is a good topic to choose because here we see the effect on our lifestyles. I'm also critical care nurse for 37 years. And at the moment, I am busy qualifying in a health and wellness coach, and I'm a diabetic educator. And this topic is very near to my heart because it also speaks to me and everybody around me. Okay, wellness in COVID area. With the outbreak of COVID, the world changed totally. People were forced to isolate in their rooms and in their homes, in their rooms, and everybody is at home. I remember the time when all of us were having fines if we were not in our house and we are found in the street. The school is closed, businesses are closed, and a lot of people work from home. Sorry. People lose their income and they can't manage their lifestyles than before. They can't afford healthcare and even a healthy lifestyle. Can you remember when we had this? I can't even remember when did I have a family gathering, when we were as a family together, friends together, and all those things. If you look at this picture, this is what we used to, and now this is what we're getting. Everybody is on the front of their computers, and then if you are with other people, you are so far away and everybody's busy with their own business. This is just a dream. Before COVID, you could actually go and enjoy the nature, everything. After COVID, you do it via Zoom. What lifestyle factors can influence your health positively? Exercise, socializing, healthy eating habits. If I say now about exercise, in Saudi Arabia, you can't exercise when it's summertime. It is very hot. And also you can't go to the gym because it's locked down or it's, you're not allowed to go there. Socializing, unfortunately, we are made to be social well-beings or people. We like to social with our friends, to our family, and just have gatherings. Now we're not allowed to. And also, we are too scared to do it because of the effect. Maybe I will get COVID or get sick. Healthy eating habits. If I go to the shops and I look what people put in their trolleys, it is terrible. Because now you have comfort food. People don't even want to eat healthy. They're not even in the mood. What can influence our health negatively is unhealthy eating habits. And this is what we can see. A lot of people can't afford food, or they just don't cook. In Saudi Arabia, this is a very good example. People don't like cooking. No exercise. You can't go to the gym. If you do it at home, it's boring because you do it alone. Of course, stress. I feel so sorry for people who sit and work at home. Sorry, it is so stressful. Your back ache because you sit the whole time. And remember, you're always at work. Because in 7 o'clock at night, 8 o'clock at night, people will think that you can still work. And it's not healthy for people. Then you get isolation. Sorry. Isolation has a big effect on our health because what we see now is a lot of suicides, a lot of mental illnesses. And if you have that, your stress is higher, you don't eat or you overeat, and also you don't exercise. COVID lifestyle, this is what I also just say. So if you don't do the good habits, you will, the way that you can have a stroke, diabetes, or obesity and mental illness is very high. The diseases what we're going to discuss today is diabetes. This is the disorder where body don't produce or enough or respond normally to insulin. I don't talk about type 1. Type 1 we know is different from type 2. We see an increase in type 2 because of the lifestyle. Normally it is people later in their lives, and also the lifestyle, the things that they do. Obesity is a complex disease, and this is where you have an excess amount of fat. And then stroke, I just want to see if I cannot make, yeah, that's it. Stroke, if blood supply to the brain is interrupted, we do know it can be ischemic or hemorrhagic, reduces or no oxygen and nutrition to the brain tissue. And I don't know, people who really work in a stroke environment, if they see an increase in this, but we definitely see an increase in diabetes, and we do definitely see an increase in obesity. Diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. Most of the food you eat is broken down into sugar, also called glucose, and released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. And then insulin acts like a key to let the blood sugar lower. If you're overweight and obesity are defined as abnormal or excessive fat accumulation that may impair the health. Body mass index is a simple index of weight for height that is commonly used to classify overweight and obesity in adults. It is defined as a person's weight in kilograms divided by the square of his height in meters. That is adults. Okay, for adults, the WHO defines overweight and obesity as follows. They say if your BMI is greater and equal to 25, is overweight. Obesity is a BMI greater than 30. Now, if you look at people, they might have a BMI 30, but look at their fat content, it might be 50. So 50% of your weight is fat and not lean muscle. So BMI provides the most useful population level to measure overweight and obesity, and it's also the same for females and males. For children, age needs to be considered with defining overweight. So if a child is under 5 years of age, overweight is weight for height greater than 2 standard deviation above WHO child growth standards. So the people that works with children, they also have like a growth chart, and then they can work it out. And what we see is, I'm working in pediatric ICU, we see more obese children these days. And what we also see is more children with diabetes. But as we know, the diabetic children, and especially if they've got DKA, they are type 1, but we also see an increase in that. Stroke, there's something that happens to block the flow of the blood. So the brain cell starts to die within minutes because they don't have oxygen. So the ischemic, we know that there is a block in the vessels to the brain, and that can be fatty deposits called plaque, and also cause blockages by building up in the vessels. Hemorrhagic, you know that is a bleed that happens in the brain. Eating habits in Riyadh, a cross-sectional study were done regarding the impact on eating habits, quality and quantity of food amongst adults in Saudi Arabia. And the conclusion is that good dietary habits increase but the quality and the quantity of the food was compromised. What we see is in the beginning of the, oh, really? I don't know my phone, sorry. In the beginning of the COVID era, people were very unhealthy because now it's shocked. People are scared. People are fined if they get out of their houses. So the quality of food was not so great. But luckily in Saudi Arabia, we've got a very good, thriving online way of getting groceries to you, but also Hunger Station is also thriving. So in the beginning, we saw a lot of people eating a lot of burgers and hot dogs and all those things. But lately, I think because they picked up weight, they do try to eat healthier. I can see a definite change after the amount of people that are positive in Saudi Arabia, that people try to gain their healthy lifestyle again. Also, people are hesitant to say that it's going to stop very quickly. The doctors and the endocrinologists that I talk to, they say it will take years before people will be healthy again. But we can actually start. What is the COVID lockdown impact on obesity? A study regarding the impact of COVID-19 lockdown on patients with obesity after intensive cognitive behavioral therapy, a case control study in Italy. So show that weight loss reduced with the COVID lockdown. We see people are more obese because of the lifestyle, because of what's happening in our lives. Effect of unhealthy lifestyle, the complications are numerous. Unhealthy eating habits goes to obesity, diabetes, and also complications of diabetes. And with a sedentary lifestyle, you know that if you sit the whole day and you're not exercising, you get also emboli, and also with obesity, you get your effects. Other complications of COVID lifestyle is depression and suicide. And we see that more and more and more people gave up, especially at your elderly population. They give up. They never go out. They can't even go to the doctors because of their family are busy, or they're not allowed to go out, or they're also scared to go to the hospitals because there's COVID cases. Then we see the school children. The school children definitely had a very good example regarding mental illness because of the COVID lifestyle. They don't see their friends and they like to socialize. Studies were done, and I just take a few ones. The Worldwide Association of Lifestyle-Related Factors in COVID-19 Mortality. What they say is that if you are overweight and the elderly person, you actually have an increase in COVID-19 mortality. And this is a problem with it. Yeah, you might not get COVID, but what if you get COVID? You will, your effects and your mortality is much higher than with other people. Then the stroke, acute management and outcomes during the COVID-19 outbreak. They say patients with COVID-19 have more severe strokes and poorer outcomes despite similar acute management. So if you're already obese, if you already have diabetes, it makes your risk for a poorer outcome much, much higher. Obesity, diabetes, and COVID-19, an infectious disease spreading from each collides with the consequences of an unhealthy Western lifestyle. If you look at the Western lifestyle, it's so easy to get food that is already made, and we know that it's full of sugar, full of oil, because it makes you, for the beginning, it actually satisfies you, but later on you're hungry again and then you want more food. So consuming excess calories with limited physical activity are the metabolic derangements culminating in diabetes and obesity. And this is now a pandemic. We always thought that COVID is a pandemic, but I think our lifestyle is starting to win the contest. All the factors that contribute to your metabolic conditions, then there is a higher inflammatory response and tissue damage, and this results in increased metabolic activity. And we see that the patients who has this gets very, very sick. Thank you for the vaccine. Thank you for people that are adhering to what we are saying. That the cases are less, but still we're not out of the COVID era. Many patients experience stress and exercise less due to the COVID-19 pandemic. Glycemic control in patients with T1D, that is type 1 diabetes, was worse than in the previous year. So we can see that even with type 1, it is worse. And it's because of stress and your lifestyle. Another study that I looked at is lifestyle factors in the prevention of COVID-19. Home confinement may lead to a variety of unhealthy behaviors, such as adoption of unbalanced high-calorie diets. I know that if I'm at home, I nibble the whole day, and it's not actually healthy, because if you don't exercise, what is going to happen? So you reduction in physical activity. Some people are drinking more alcohol and smoking more tobacco, and then screen time. With the screen time, they say the UV light or the blue lights actually impair your sleeping patterns. So what must we do? We're forever on our computers, we're forever on our phones, and this is interfering with our immunity because we don't sleep well, we don't exercise, and we don't eat well. So they say a balanced and healthy diet is important building block for a strong immune system. So we know that if you're not healthy, if your blood glucose is too high, if you are overweight, you know that your immunity is going to go down. Also, there is a relationship between sleep and immunity. Sufficient restorative sleep is needed for adequate immune function. I don't know about you, but sleeping is a bit of a problem for me because you worry about this, you worry about that. You're not tired enough. You may be tired physically, but then you're not tired emotionally, or vice versa. Physical distancing and face masks are undoubtedly the best preventative measure to avoid exposure to the novel coronavirus. However, appropriate lifestyle changes in regard to nutrition, exercise, sleep, smoking, and alcohol may contribute to shifting the population distribution of infection risk and preventing severe outcomes of COVID-19. And I must say, this is very evident. I can see the COVID cases are much less, but the effect of that, the people who had it before and was very sick, some lost their lives and some are in rehabilitation and it can take actually a year, sometimes a little bit longer, before they can work again or do things that they did before. So this is now what we are doing. We say, what a great time to be alive. It's like the Great Plague with a Wi-Fi. Thanks a lot. Any questions?